Hi, welcome back. This is Maggie Mann from Southeastern Idaho Public Health, and today I have with me Traci Lambson. Traci is our lead food safety protection environmental health specialist, and she has a master's in health education. She's actually worked in public health for over 20 years, and about a year and a half ago transitioned to be an environmental health specialist and is now our lead in our food safety program. So we wanted to bring Traci on today to just share some information about eating in restaurants and what to look for, what we look for when we're doing health and safety inspections. Because most of us like to eat out. For some people, it's limited to celebrations, things like birthdays or anniversaries. Other people do it more frequently. And we just want to make sure that you are aware of what we look for as far as keeping food safe, working with the hospitality industry to help them employ best practices on a regular basis so that we're reducing the likelihood of people becoming sick after eating out at a restaurant. And thankfully, that's something that doesn't happen in this region very often. So Traci, thanks for being here today.
Absolutely, thank you.
Yeah, so tell us, what kind of food vendors need to be licensed in the state of Idaho?
Okay, I'm glad that you're asking this. There's actually a lot of different types of vendors that are required to have their license in Idaho. So this is kind of a quick overview. It's a big long list, but if you were, if you're a restaurant owner, you need to have a license. If you are a tavern owner, if you're in the school industry, so for the cafeteria, you need to have a license. A convenience store needs to have a license. A grocery store needs a license. If you have a food pantry, that is needed as well as if you were running a shelter, and there's any type of food operation going on, you need to have a food license, as well as catering operations need a food license, meat markets, delis, bakeries, and then what we've seen a lot of lately, food trucks, any type of mobile food unit needs a food license, and then any type of temporary event. Now, a temporary event might be something like the farmer's market. It might be something that's just a one-day event. It might be 2 or 3 days. It might be a 4+ day event like the Eastern Idaho State Fair. There's also a license that you can get that covers multiple events. So you come in, you get your license, we walk through that pre-operational inspection, and then you're able to go all around the state of Idaho. So there's a lot of different types of licenses.
Yeah.
And the reason it's very important, and you might wonder why is this an issue? Why do we have to have our license? The reason why is because the people that are obtaining these licenses are serving something called TCS foods. And TCS foods are time and temperature control for safety foods.
Okay.
And so that's very important. And we look at TCS foods, they require time and temperature controls to limit the likelihood of foodborne pathogen growth. And so that's very, very important. So these people, it might be custards, it might be meats, it might be milk, it might be any type of dairy, things that need to be at a temperature control.
Okay, and so those foodborne pathogens, those are the things that can make us sick if we eat them, right?
Yes.
Okay, great.
So we need those control measures in place.
Okay, so why do we inspect food establishments?
Okay, so I can kind of give you the shortened version. That shortened version would be basically to protect the consumer. Also to protect the community at large that might go to that establishment, and to protect the establishment owner. But to give you kind of a more detailed answer, the reason that we inspect is to make sure that operators or food establishment owners, making sure that they're in compliance with the Idaho Food Code, so that they're doing things that the regulatory authorities are needing them to do to keep people safe. Also, when we're out there doing inspections, we're also making sure that food workers are following something called good retail practices. So making sure that they're doing this on a regular, everyday operation in their establishment. This is also a really good time making sure that employees have good hygiene practices and good food safety and good food handling practices and procedures in place as well.
Okay, so how often do you inspect a food establishment?
So typically, we go out to food establishments at least one time in a calendar year.
Okay.
When we are out there doing inspections, and I'm going to talk about and elaborate this in the future, but if we see critical risk factors, so things that need to be corrected right away, we're hoping to get them to correct that right on site, right during our visit. While we are there, they're making that change. For example, something that we might be seeing is, we're looking at a temperature control for food. Maybe their cooler is slightly out of range, so we're getting, the cooler might need to be adjusted so it's 41 degrees or cooler than that. Maybe they're cooking a product and it's not up to the correct cooking temperature, so that product goes right back on. We're making sure the internal temperature gets to that desired requirement.
Okay.
But things that can be done right then and right there. Now, there's sometimes that there are violations that you need a little bit more time for. They might be a critical risk factor, a critical violation, or they might be a non-critical violation. But if that's the case and we do need a little bit more time, then we do come back for a follow-up inspection. But there's always a time parameter involved.
Okay. So just a couple of questions about those annual inspections. Do you schedule those? Do they know that you're coming?
That's a great question. So typically, most inspections are unannounced.
Okay.
I mean, there might be an example, if there's an operation that, they're only operating and on a particular day at a particular time, it's a mobile unit that's coming through, it's only going to be here one day, then it might have to be something that's a little bit more arranged, but almost everything is unannounced.
Okay. And then what happens if we get a complaint from a member of a community that they have a concern about something that they saw or experienced at a food establishment? How do we respond to that?
So we work very closely, the environmental health specialists work closely with our epidemiologists, and what we do is we collect all the information from the complaint, and then that complaint is assigned to the inspector that oversees that establishment, and then we go out and we conduct an investigation.
Okay. And so it is possible for a restaurant to be inspected more than once, but
yes.
But those are only in situations where we've had a concern conveyed to us by a community member.
Right. So we're mandated to be out there one time a year in a calendar year, January through December. But if there was a need, like if there was a complaint or for any other reason, if we needed to go out, then there could be that second or more inspection.
Okay. So what kinds of things do you look for when you go into a food establishment to conduct that annual inspection?
Okay. So what we're looking for is, as environmental health specialists, we go into the establishment, and we're always trying to kind of have that collaborative opportunity to work with the operator, to work with the owner, to build that relationship and build that rapport. So if they have questions in the future, they can reach out to us, they know who to call. But when we're going into the establishment, we're really looking for those critical risk factors that could lead to potentially a foodborne illness. So we're looking for anything centered around food handling. We're looking at time and temperature of cook time, storage time, hot holding times, anything involved with food preparation, anything involved with hygienic practices, anything involved with employee health, making sure that they have a proper sick policy, that they know how to respond to a vomiting or diarrheal event, those types of things, those critical risk factor types of situations. At the same time, we are looking for, as environmental health specialists, something called good retail practices. And that is something that would kind of fall into those non-critical categories. Important, but non-critical. So maybe the time sensitivity isn't quite there like it is with a critical risk factor. These things might not necessarily be getting a person sick right now. It can't go unaddressed, or it potentially could. But these things would be like making sure that their equipment is properly working and that their facilities are up to standards, making sure that everything in their facility is in good repair, good maintenance, cleanliness, things like that.
Okay.
So those things, between the critical risk factors, between the good retail practices, pulling all that together at the end of the inspection, having that collaborative process with the operator or with the manager, having dialogue of like, this is the findings, this is what we see, some changes that could be made. How do we want to come up with a plan of action to make those changes, and what's an adequate time frame?
Okay. So you're really working as a partner
Absolutely.
to support that food establishment and help them protect themselves by following those safe practices on a consistent basis.
Absolutely. I think one of the best things is when you get a call down the road, it might be a week, it might be 3 months later, but the operator remembered the visit, they remembered to reach out to you because they have a question that it might just be a very minimal question. It might be something, not related to what we even discussed during our visit, but they remembered to reach out, to have that conversation, so we feel like we're building that rapport and that relationship, so it can be, we want both parties at the table.
Okay. Well, that sort of brings us to the next question. Can you tell us a little bit more, dive a little bit deeper into the different kinds of violations, like critical versus non-critical?
Yeah.
Just so people have a good understanding of what are the pieces that really matter when you're working with a food establishment.
So it's a very, very big package to kind of digest when we're looking at violations. So, of course, taking a look at the critical violations and what that really means when we're looking at our inspection form. So we do our inspections online on the computer, but if we were to look at an inspection form, we're taking a look at 56 different categories.
So there's
some
a lot
critical,
there.
Yes, there's a lot there. Some critical, some non-critical. But if we're looking at the definition of critical, so a critical violation, or on our form, it's called a critical risk factor. It's a provision in the Idaho Food Code that if you're not in compliance, it's more likely than any other violation to contribute to food contamination. It can contribute to illness or any other environmental health hazard. So we really want to focus on the critical violations and get those fixed immediately. 7 to 10 days is that time frame. We might be able to get them corrected on site right now.
Okay.
That's perfect, but it might take a few days. It might take a week, but not up any more than 10 days is that time frame. So that's what the critical violation piece looks like. Then there's the non-violation or the non-critical violation piece. On our form, it's referred to as the good retail practices.
Okay.
So with those good retail practices, and I already mentioned this a little bit, but that's really looking at equipment, it's looking at cleanliness, it's looking at physical facilities, keeping things maintained, keeping things repaired, making sure that hoods are serviced, making sure that proper plumbing, that things are adequate in the physical facility as a whole.
Okay. So, like, with the critical violations, that would be something pretty major, right? Like a sewer backing up into a kitchen, or food that is supposed to be hot that's not at the right temperature, or cold that's not at the right temperature.
That could definitely lead to some contamination or a foodborne illness, absolutely. And what I can do is I can kind of walk you through, so again, showing you this form. If you were to look at it, number 1 through number 29, so this entire section here, those are the critical violations or those risk factors. So with those risk factors, I'm just going to give some examples.
Okay.
You gave some great examples. I'm just going to add to that. So starting at the very top, we're really looking at making sure that the operator is able to demonstrate knowledge, that they know good food handling practices, that they're able to demonstrate that they have taken the accredited course. There's an accredited course. It's the American National Standards Institute, so the ANSI certified course, like a ServSafe course that a person goes through. It's an 8-hour course. They have to take a proctored test. They have to get a certain score, and then they get the certificate when they pass. It's good for 5 years, but they post that up. They have that in their establishment, and that really it's a good standardization of showing, you know this content. And we like to see that there's someone, preferably on site, that has that certificate. If they're not on site, it needs to be someone that's employed that has supervisory authority that, pick up the telephone, someone could call and say, hey, I have this question, and then they kind of get walked through the proper procedure and process.
Okay.
So that's one of the things, making sure that certification, that someone always has that certification, making sure that they have written procedures, vomiting and diarrhea procedures. So if that event occurs, they need to be able to properly respond in a timely manner. They need to know how to do it very quickly and get that taken care of. So that's an example. Another example is if maybe someone was improperly storing maybe a food container or a drink. Maybe they have their drink and it's in an open container and it's in a food preparation area.
Okay.
That would be a violation. So there's certain places you would need to keep things, certain places that you're not eating over food prep areas, that you're not using tobacco inside the facility, that there's parameters and regulations for different things, but making sure that those procedures are being followed. Another example would making sure that you need to have proper hand washing stations. So if we went to an establishment, they didn't have soap, they didn't have disposable towels, that would be a violation, either one of them or both. Or maybe in their hand washing sink they have some dishes, that would be a violation. Or there's the mop bucket that's blocking access to that sink, that would be a violation. Okay. Food being improperly separated or protected. So this is really looking at stacking order, making sure that we have, raw chicken on the bottom, ready to eat foods at the very top of the shelf, that you don't have any juices leaking down to the right. You don't want to have a product that you're going to consume that has chicken juice on it. So you need to make sure you have proper stacking order. That's another example. And then proper time, cooking times, reheating times, proper hot and cold holding temperatures, making sure that food's date marked properly, as well as storing toxic chemicals. And then if you are preparing any foods that are raw or undercooked, then you have a consumer advisory on your menu.
So like eggs.
Like eggs.
Okay.
Or maybe it's cooked to order, someone can order a steak rare.
Okay.
So as long as that's identified. So those are some of the critical, the things that we can get corrected now types of things.
Okay.
And then we have the non-critical. And again, I don't want to make it seem like there's not importance on non-critical, because there definitely is. Is it something that's going to make someone sick right away? Most likely not. A really good example would be, you might go into an establishment, you might find that there's a hole in the wall or a hole in the ceiling or a hole in the floor. By itself, that doesn't seem like that's much of an issue. It is, but it doesn't seem like that's much of an issue. But if it goes unaddressed, if we don't get that repaired right away, then there might be entry of rodents, of pests, and then that could adulterate food, and there could be contamination, and then there could be sickness. Mm-hmm. And that's where we've got to get on it. So with non-critical violations, or with a good retail practice violations, there is importance, but the time frame might be different. If we need to get some plumbing fixtures fixed, maybe they have a food prep sink that is not right now directly, it's directly drained, and we need the food prep sink indirectly drained. That might not happen today. It might take a little bit of time, but that needs to happen. Or if they need to have, they have tile that's broken and cracked on the floor, mm-hmm. That needs to happen as far as having some repair or replacement. It might not be today, but it might be, 6 weeks down, the path, but it's going to happen.
So then, if they have those non-critical items that will take some additional time, that mm-hmm. can't necessarily be corrected right away, what kind of follow-up do we do to make sure that those changes were in fact put into place?
So that's where we really, when we're working through that report process, that inspection report, it's really important to have the right player at the table to kind of look at an adequate time frame. So like looking at some of my examples, it might take, it'll be a follow-up, most likely it would be a follow-up inspection. But it might be something that takes a week. It might be, getting repairs or get the right professional in to maybe fix. Maybe there's some ice buildup in a freezer and they need to, or there's some condensation and they need to do some repair work. It might take a few weeks, it might take a month, it's just whenever that person can get there. We don't go out longer than 3 months, and so like I said, it might be a follow-up inspection, or if it's something that we physically can see through a violation correction report, then someone might be able to fill out a violation correction form and then snap a photo and send it to us so we can see that correction and that it has taken place.
Okay.
But we just need to work very closely, and communication definitely is a key piece, because we like time frames, we have to have time frames, but we know sometimes some things are out of your control, but having that, again, collaboration and communication is definitely essential and key.
Okay, so that's a great segue actually to my next question, which was if you could talk about the balance between enforcement and education when you're working with food establishments and the people that are working in them.
Okay, so I think balance is key. Like a scale comes to mind when we're saying this. You really can't have one of these elements without the other. You have to have education to get compliance. So if we can really work as environmental health specialists on making sure that people are well aware, which through their pre-operational inspection and their first inspection, I mean, it's very clear. We share that inspection report so they know what we're going to be asking. We know what we're going to be looking for. So they're very clear on what the expectation is. But even probably more important is not the what, but it's the why. Why is this important? Is this going to get someone sick? Stacking orders is very, very important. Cross-contamination is extremely important, but understanding if they don't do one thing, what might happen. So the why is very, very important, and I think having the why helps drive compliance. So education is very important. I think it'll help lead to compliance, so later on down the road we're not working so much on having to do an enforced inspection. I mean, again, we know sometimes things happen, but keeping that process kind of close-knit, having that communication, and then letting operators, letting establishments know that we want to be here to assist and to help and to make this process as easy as possible, and to reach out if there's something that we can do, or if you are kind of stuck in the process or don't know what to do, reach out to us, because we want to be part of that collaboration.
Well, I love that, Traci, because there's sort of that stereotype out there of the dreaded health inspector, and I know that the approach that you and your team take is very different from that. You want to help these places succeed and be successful, and you want them to be, here for as long as they want to be here, and by working with you and putting those practices into place, it's protecting them as well as their consumers or customers. So just thank you so much for taking that approach with them.
Absolutely.
So just to wrap it up, if there's one thing that you would like to leave people with about the food protection program, what would it be?
I would think, you already kind of summarized, we are here to help. We want to see that success. So if it's a question, or if it's something that's going to involve quite a dialogue or emailing or multiple phone calls, please do reach out, because we are here to help a business, to help a person succeed. And when we do see the successes in the community, it's so delightful to see people grow and blossom. And it all started with a plan review. On paper, we saw this vision, and then we see it in stages of something growing, and then it blossoms, and then it's one establishment, and then it grows into a couple establishments, and we want to just be here along the way to help in any way that we can.
Thank you so much.
Yeah, thank you.
Yeah, and just so you all out there know, on our website, which is www.siphidaho.org, if you go to our environmental health section, you can look up our historical food inspections for all of the establishments that we license and inspect in our 8-county area. So we encourage you to do that. If you have questions, please give us a call, 233-9080, And thanks so much. Until next time, be well.